Hey everyone, it's Eliana again, back with another one of our founders to share her message with you about her experience and her vision for the future. So welcome, Maria Paz. Avery, what do you have to share with us? And please tell us a little bit about what you're currently doing now.
Thank you, Eliana. It's a pleasure to be here with you and to share some thoughts about the development of NCIHC. As some people might already know, I entered NCIHC out of some work that I had been doing at Education Development Center, where I was employed at that time. And we had a project to develop a certificate program for healthcare interpreters at the community college level. My own background had been in a number of areas that always included working around the issues of language and culture, and particularly around cross-cultural communication. So I had done work in social services. I was also trained as a psychologist, and so I had worked in the Latino community with Spanish-speaking patients and helping them negotiate not only the mental health system, but also healthcare in their communities. And so I always had this really interest in making that connection between language and culture and cross-cultural communication. So when this project came up at EDC, I was thrilled to become its director. And so at that time, the big issues in Massachusetts were coming through the Massachusetts Medical Interpreters Association. And so as I began the work, I was told, well, the one person you have to talk to is Raquel Cashman at Boston City Hospital. And she was the guru of healthcare interpreting at that time. And of course, I was very nervous because I know she would say, well, you're not an interpreter, so why are you interested in all of this? But we had a wonderful conversation, and she actually connected me with Dr. Putch out in Seattle, who was also really beginning the work. Well, not really beginning. I mean, he had been already involved in a lot of work with healthcare interpreting through his own experiences as a medical doctor. And he was just at that point, I think it was the first meeting that he was calling of healthcare interpreters across the United States and inviting key figures. And so Raquel Cashman said to me, well, you should really get in touch with Robert Putch and have him invite you to this meeting. And I said, okay. And I felt like I was going to go through this third degree, you know, of who are you and what are you about and why do you think you can be part of this group, you know? So I called him and we had a long conversation. And he was somewhat reluctant. I think he might laugh at this when he hears this, but I think he was a little bit reluctant about inviting me and really questioning who was I and what did I know about any of this. And finally, I said to him, well, you know, I won't ask you for any financial aid in coming to your meeting. I can take care of that and I'll come, you know. And so I don't think that was the deciding factor, but I think he realized that we could be doing some important work here in Massachusetts with developing a degree program.
And there was commitment from you, yes.
And there was commitment from me, yes. And so I went to that first meeting, which was, I think, one of the most interesting meetings I had been to in a very long time, because the people who were there were so passionate and so committed to the importance of healthcare interpreting to bring the services that really the different language communities deserved and should be getting in terms of quality healthcare. What was really fascinating about that first meeting is that we were starting from the very beginning, where one of the big issues that came up was the contrast between what was still very prevalent in the world of healthcare interpreting, which was the black box approach. You know, the interpreter was there to hear one language and get the other language out and nothing else. And then there was this other group that included Bob Kutch, Joseph Kofort, a lot of other people like Raquel and so on, who said, no, the interpreter has to take a more active role at times because they have to be able to really bridge that linguistic and cultural gap in order to avoid miscommunication, which in the healthcare field could be very critical if the messages were not transmitted accurately. That dynamic of the folks who still believed in the black box approach and those of us who were into the cross-cultural communication between, really supporting that between the patient and the provider, really generated some very, very interesting dynamics. But I think what was really important about that process was that everybody was very respectful and listened to each other and really wanted to learn from each other. And it was a very mixed group of people, you know, and not just the usual, you know, Spanish and Asian languages, but we had representatives from the Native American groups also. And so those different perspectives really generated some very important learnings across the different perspectives.
And I want to just highlight for folks to be able to see the setting in their mind. This is before Zoom meetings. This is before internet. So I can only imagine the excitement of everybody who had been working in their own little silo, feeling like they were struggling all alone with this issue. How do I do this? How do I give my limited English proficient patients a similar, if not same experience as my English speaking patients? And then you all are in the room together, the energy. I am like so jealous. I wish I could have been a fly on the wall for that meeting. I can only imagine how much more synergy and energy there was once you all came in contact with each other. And from that, look at everything that has happened.
Absolutely. I mean, those meetings were just not only stimulating intellectually, but also very, how would I say it, really deep connections were generated among the people who were there. And it continued, you know, from the formal meetings that we had into when we were having lunch or dinner together. So that kind of atmosphere, you know, we were in a retreat setting, you know, that kind of atmosphere where we were there all the time. But I have to say also that while we had very serious conversations, there was also a lot of humor and a lot of laughter and a lot of really good feelings among everybody, even after we had had a very serious discussion. And so it really was amazing. And what ended up being was that out of that first meeting that I went to, I was then asked to facilitate the other meetings that came up. And so that was really my big role. You know, in addition to contributing to the discussion and the work we were doing here in Massachusetts, the big role that I took on with those early meetings was to facilitate them. And so it was really a challenge, actually, because as I said, there were people with very strong feelings and very strong opinions, and trying to get that all together and come up with some kind of understanding and consensus, you know, was really quite a job, really. But I have to say that everybody was committed to working together and to really coming to a shared understanding of what was important in developing healthcare interpreting as a profession. And I think that's the biggest contribution that NCIHC has done. And that is that it's really put forth the movement of healthcare interpreting as something that, oh, anybody can do if they're, quote, bilingual, to really recognizing that it is a very highly developed skill that is required. It's not only about language and which is hard enough as it is. It's also about the cultural understanding or misunderstandings that can arise. And it's about really providing good healthcare, quality healthcare for people who might not get it because they don't speak English. And so that's, I think, for me, the biggest contribution of NCIHC as it has developed into really a national force in the field of healthcare interpreting.
And for that, we all thank you. We all thank you because we would not be considered members of the medical team if we had not started with the foundational pieces of standards of practice and code of ethics.
And the code of ethics.
Moving towards certification and everything that brings, the continuing education, the prior preparation and training. So thank you so much, Maria, for joining us today and giving us a little peek into that early window of time when all those great minds and all that great energy came together and that spark grew into the bonfire.
Yes.
We are today. Thank you so much.
Thank you for this opportunity.